بسم الله الرحمن الرحيم. Sign Frontline, May 2015. The first journal is Journal of Neurosurgery. First article, long-term efficacy and safety of internal neurolysis for trigeminal neuralgia without neurovascular compression. The conclusion is that the internal neurolysis is a safe, effective, and durable treatment for trigeminal neuralgia in the absence of neurovascular compression. Consideration should be given to performing internal neurolysis as initial treatment in younger age distribution of patient. Next, infections in patient undergoing craniotomy. Risk factor associated with post-craniotomy meningitis. The conclusion is that device-related post-operative communication between the CSF and the environment, CSF leak, and perioperative steroid use were defined as risk factor for meningitis. Ventilator-associated pneumonia was the most common infection overall. Next, impact of surgical methodology on complication rate and functional outcome of patients with a single brain metastasis. The conclusion is that post-operative complication rates are not increased by any block resection of brain metastasis, and when feasible, it is at least as safe as piecemeal resection. Next, survival impact of time to initiation of chemoradiotherapy after resection of newly diagnosed glioblastoma. The conclusion is that significant delay longer than 6 weeks may be associated with worse overall survival. The next journal is Neurosurgery. The first article, surgical accessibility of the distal internal carotid artery on carotid and endarterectomy evaluated using magnetic resonance angiography. The conclusion is that shielding of the draining vein is a potent new strategy in minimizing post-radiosurgery imaging and hemorrhage, as well as clinical deterioration following gamma knife therapy for intracranial AVM. Next, silent arteriovenous malformation, hemorrhage, and the recognition of and rupture arteriovenous malformation patient who benefit from surgical intervention. The conclusion is that no clinical or anatomic features differentiate these patients from unruptured patient except the presence of hemosiderin and macrophage. Silent hemorrhage can be diagnosed using magnetic resonance imaging with iron-sensitive imaging. Silent hemorrhage portends an aggressive natural history and surgery halt progression to re-rupture. Next, use of prothrombin complex concentrate as adjunct to fresh frozen plasma shorten time to craniotomy in a traumatic brain injury patient. The conclusion is that prothrombin complex concentrate as adjunctive to fresh frozen plasma decreases the time to craniotomy with faster correction of INR and concomitant decrease in the need for blood product requirement in patient with traumatic brain injury, exclusive of pre-hospital warfarin therapy. Next, long-term functional outcomes and predictor of shunt-dependent hydrocephalus after treatment of rupture intracranial aneurysm in the BRAT trial, revisiting the clip versus coil debate. The conclusion is that no difference in shunt dependency after subarachnoid hemorrhage among patients treated by endovascular or microsurgical means. Patients in whom shunt-dependent hydrocephalus does not develop after subarachnoidal hemorrhage tend to have improved long-term functional outcome. Next, draining vein shielding in intracranial arteriovenous malformation during gamma knife, a new way of preventing post-gamma knife edema and hemorrhage. The conclusion is that shielding of the draining vein is a potent new strategy in minimizing post-radiosurgery imaging and hemorrhage, as well as clinical deterioration following gamma knife therapy for intracranial AVM. The next journal is World Neurosurgery. The first article, microsurgical clipping of unruptured middle cerebral artery bifurcation aneurysm, incidence and risk factor for procedure-related complication. The conclusion is that the procedure-related complication rate was 3.6%. Patient with MCA bifurcation aneurysm with the posterior-inferior projection, shorter distance between ICA bifurcation and MCA bifurcation, and larger horizontal angle may be at a higher risk of procedure-related complication when performing microsurgical clipping. Next, a predictor of severe complication in intracranial meningioma surgery, a population-based multicenter study. The conclusion is that severe complication after meningioma resection are more encountered often in elderly patients more than 70-year-old, dependent patient, and patient who underwent longer lasting surgery more than 4 hours. Patient selection, including careful consideration of the individual risk-benefit ratio, is important in improving the safety of intracranial meningioma resection. Next, clinical characteristics and the neurologic recovery of patient with cervical spinal tuberculosis. Should conservative treatment be preferred? A retrospective follow-up study of 115 cases. The conclusion is that the effect of surgery is quick and the effect of conservative treatment is slower, but no difference in neurologic recovery was found in the long term. Conservative treatment should be tried in every patient with cervical spinal tuberculosis with no obvious indication for surgery. Next, outcome of cranioplasty with synthetic material and autologous bone graft. The conclusion is that synthetic materials for cranial bone defect reconstruction exhibit more promising outcome compared with autograft. There were differences in survival rate among synthetic material. Next journal is Annals of Neurology. First article, thalamotemporal alteration and posterior operative seizure in temporal lobe epilepsy. The conclusion is that patient with bihemispheric alteration of thalamotemporal structural network may represent a subtype of mesial temporal lobe epilepsy that is resistant to temporal lobe surgery. Increasing sensitive multimodal imaging techniques should endeavor to transform these group-based findings to individualize prediction of patient outcomes. Next, uric acid improve glucose-driven oxidative stress in human ischemic stroke. The conclusion is that uric acid therapy was associated with reduced infarct growth and improved outcome in patients with hyperglycemia during acute stroke. The next journal is Journal of Neurology, Neurosurgery, and Psychiatry. The first article is a multidisciplinary clinic approach improves survival in amyotrophic lateral sclerosis. A comparative study of amyotrophic lateral sclerosis in Ireland and Northern Ireland. The conclusion is that multiple decision-making processes within a multidisciplinary setting lead to an enriched set of clinical encounters for the patient and carer that enhances the clinical outcome and structural and survival advantage. Next, brief intervention for medication overuse headache in primary care. The BIMO study, a double-blind pragmatic cluster randomized parallel control trial. The conclusion is that the brief intervention method provide general physician with a simple and effective instrument that reduces medication overuse and headache frequency in patients with medication overuse headache. Thank you.